Hi, everyone, and welcome to this latest podcast in our series where we've been talking with some amazing people doing great things for animals out in the community. And today I'm chatting with Samantha from Maneko Neko Cat Rescue. Samantha and Carl established Maneko Neko Cat Rescue in October 2012 after many years of private cat rescue and foster carers for other rescue organisations. After losing their beloved Mousie from myeloma in 2005, Samantha and Carl began taking in homeless cats, as well as taking in cats in need of care and providing the required veterinary care and then finding them loving homes. Maneko Neko is a Japanese symbol of success, prosperity, good health and happiness. And Samantha, Carl and the team hope that the Maneko Neko will bring these to their organisation and to the cats and kittens that they care for and rehome. Welcome, Samantha. How have you and Maneko Neko been going through this, what is clearly a very challenging year?
Well, thank you for such a lovely introduction. We've actually been doing really well. We've had to adapt our adoption processes to be COVID safe and to comply with all the regulations, which here in Melbourne seem to change quite regularly. But having so many people working from home has really given us, or given them, the perfect opportunity to adopt and settle a cat into their home. So our adoptions have actually gone through the roof, which is fantastic. We've also had to adapt our fundraising activities as well. So events obviously are off the table just because of large crowds and so on. So we've had to move everything sort of more to the online side of things. So we've been working ourselves to the bone, doing online raffles and all sorts of things so that we can fund this really important work.
Well, that's fantastic. And look, what you're saying certainly reflects what I've been hearing from a lot of other, particularly cat rescue organisations out in the state. And it's particularly relevant being able to be in a good position coming up, seeing as we've got kitten season coming up very, very soon. So it's really pertinent. And look, and you guys are such an amazing organisation and making such positive changes in the lives of so many cats and kittens. Could you share with the people listening the work that your organisation does and more particularly the role, I guess, that it plays in the community around you and how they interact with you?
Yeah, I mean, our primary objective is to improve the welfare and the outcome of cats and kittens in Victoria. So we do that primarily through rescuing and rehoming. We rehome around 1,200 cats each year. But in addition to that, we also have community desexing programs where we will subsidise the cost of desexing for members of the community. We have our cat cafe and cat lounge, which unfortunately is closed at the moment, but bringing people into the community to interact with cats. We get people in that have never actually interacted with a cat before. Mm-hmm. We get lots of parents that want to introduce their children to pets, and so they'll come in and spend time with the cats just to see how they interact and so on. Everybody knows that the cats are great for your health. They're great for your physical and mental health, and then that's not just hearsay, it's scientifically proven. So having a pet gives you a reason to get up in the morning. So for many people, the only person or only conversation that they might have is with their cat, and it really is great for their mental health and physical well-being as well. The other programs, sorry.
No, that's okay. Look, I just was about to say, look, I had no idea you had a cat cafe as well. My family and I went to one in Berlin and another one in London, and they're just the most fantastic places. They really are. And so when we're all free and able to travel and you're up and running again, I'm going to have to bring them up.
Please do. Absolutely do. We would love to see you there.
Fantastic. Look, obviously all the cats and kittens you've rescued and that you've found loving forever homes for hold a really special place in your heart. But are there any cats or kittens and their stories that really have just stuck in your mind, one that's carried through with you forever?
So it's been so many over the 8 years or so. I think we've rehomed over 6,000 cats.
Wow.
But the ones that stick out in my mind are really those that come to us with a treatable medical condition. And so they come to us from a pound or shelter that for whatever reason has decided that, or has given up on them. And it might be as simple as they have cat flu, or they have a skin issue such as ringworm, or they've got some lesions on their ears just from sun damage. So very treatable, lovely, happy, healthy, otherwise cats that can be rehomed. And they're the ones that really stick in my mind, because I look at them and think, if it was not for organisations such as ours, those cats would have been killed. There's also those that have, conditions that we perhaps can't change. So, a cat that might be deaf, one eye, 3 legs, and of course those that are timid and that need some time and some love and attention to really bring out their personalities. So it's those cats that really stick in my mind, because they're the ones that are forgotten. They're the ones that are left behind, and they're the ones that we can really make sure have a second chance and find great homes.
And that's a really pertinent point, and I really thank you for raising it, because we know that approximately 80,000 cats are killed across Australia per year for exactly these sorts of reasons. What's been termed as convenience killing, animals that have completely treatable conditions, and some that even when they have more challenging ones, as you say, there are always going to be people out there who are willing to do that work, and those animals shouldn't lose their lives just because that particular shelter doesn't have the wherewithal to deal with them on a day-to-day basis. And that should never happen to them. They deserve life just as much as any other. And that brings us to that exact point that I was talking about, that terrible statistic of 80,000 cats and kittens. Some of those animals are also only a day or two old, and evidence shows the best way to combat that crisis is what you were talking about before, by offering desexing that's truly accessible. And that doesn't just mean affordable either. Some of those barriers for people having animals desexed, cats and kittens particularly, are financial, but it's not the be all and end all. For some, it's the convenience of and not being able to access those facilities, or even have an easy process for them to do so. For some of them, it's time constraints. For some, it's not having the ability to put, or like having something as simple as a cat carrier to be able to put them in to take them there. And I know that organisations such as yours do that sort of work, provide carriers, and at times can also go and pick these animals up, take them to the vet, provide that subsidised desexing, and then bring them home when they're ready to come home as well. And that takes all of that accessibility out of the equation for them. And it's certainly one of the things that I've been speaking with the government over, because we do know that government does provide some types of support at different times of the year for local councils to do subsidised desexing, but the program is nowhere near big enough, and it doesn't reach those people with those accessibility problems. So that's something that we've been talking to them about, and I think I'd really like to hear your perspective on where you think that might head, and what sort of level you think that the government needs to become invested in to be able to help make that happen.
Absolutely. So, cost is a huge factor. It's not the only factor, but it is a huge factor. And I know if you contact some of the large chains of veterinary clinics, to desex a female cat can be over $300. And that's simply not affordable for most people. Even your smaller veterinary practices, your family vets would charge over $200. So affordability is absolutely one of the issues. We've found that when we do offer discounted desexing, so we might go out to the market with an offer of $49, desexed, chipped, vaccinated, health checked, and so on. People will travel if they have the ability. They will travel in order to be able to access those discounted services. So that certainly does address one part of the issue. You're right. But the secondary part of the issue is accessibility as well. So offering cheap desexing, but you're in the middle of nowhere, or you're not accessible for people, is certainly not going to be particularly helpful. So you really do sometimes need to hold their hand through the process. Some people, even just getting a cat into a carrier for somebody that's perhaps older or has mobility issues of some kind, getting a cat into a carrier is not as easy as just saying, here you go, pop in the carrier, that'll be fine. Cats are much smarter than that. They're very suspicious by nature. and they certainly know that something is up. So if we can assist people to do that, we absolutely will. So there needs to be sort of a whole solution around desexing, not just, yep, here you go, you can do it for $50 or $100 or whatever it is. But we can also help you with transport. We can help you with getting them into a carrier. We can do all of those sorts of things, and really provide them with a more rounded solution. So the councils and the government do have some programs, but they are very limited in scope. I know the voucher program, where you can, if you've got a healthcare card, you can apply for a voucher from your local council. It takes about 1/3 of the cost away. It still remains prohibitively expensive, and there's also a whole raft of sort of red tape around actually getting that voucher. A lot of councils, you have to go into the council office. Well, that's not necessarily easy for everybody either. So there really are a whole heap of barriers that need to be addressed in order to assist people.
Yeah, great. And look, so I've got one more question for you on desexing, and then I want to move on to one of those other barriers that you just spoke about. I've got a specific question around that. What would a full-time subsidised desexing program financed by state government mean for Maneko Neko and for other cat rescue organisations?
So the biggest inhibitor to us being able to rescue the number of cats that we're asked to rescue, and every day, as much as we would like to be able to say yes to every cat that's offered to us, there's probably 10 that we have to say no to. So being able to access cheaper veterinary care for those cats that we are able to take into care. Here's my cat just now, going to walk in front of the camera, of course.
Hello.
But being able to get cost-effective veterinary care means two things. It means, one, less cats going into our shelters, and therefore less cats requiring rescue from rescue groups. It also means that when we do bring a cat into care, that those costs are lower than currently available, and therefore we're able to rescue more. So that's our biggest inhibitor, really. You know, I said I've rehomed 1,200 cats this year. If desexing was half the cost, then I could have rehomed 2,400. It's as simple as that. It's as simple as the numbers.
Fantastic. And look, and one of the other ways that I've heard is a great way to reduce the numbers actually revolves around a state government commitment which was made prior to the last election. It was an election commitment from 2014, and that was having immediate reuniting. So removing for vets that requirement to have an 84Y agreement with their local council, so that they didn't have to go through all those loopholes where a cat or a kitten is brought in. They know that animal because they know the family. They can scan the microchip, the phone number's in front of them, but they're not allowed to call them and immediately reunite them. They have to go through the pound or shelter. And that brings that whole scenario again of those animals going into an unfamiliar environment. They become anxious. They may pick up something that's there from another animal. And you have all these other things come into play then. And it's just another unnecessary step in the way of reuniting those animals with their families. So, you know, one of the things that we called for recently in the chamber was for the government to fulfil that election commitment to make sure that vets have that capacity. How much of a difference would that make as well?
That would make a huge difference. So certainly if the cat remains in its local area, so for example, someone finds a cat, feels that this cat may be lost, takes it to a local vet, it's still within its local area. And if you look at many of the council contracts currently in place, so for example, if you live in perhaps Brunswick and your cat is impounded, your cat ends up at Epping. Epping and Brunswick are not that close together. And the pound out at Epping, the RSPCA facility out at Epping, is literally in the middle of nowhere. The public transport access is very limited. You would need to have access to a car to go out there to actually go and find your cat. If your cat was taken to a local veterinary clinic and they were able to simply check the microchip, contact you, and return your cat to you, much simpler process, absolutely. The second issue that surrounds impoundment of people's pets is obviously that there's then a cost attributed to that. So if your pet is impounded and ends up at one of these facilities, the cost to get your cat out can be several $100s. I know there are some country pounds where it is $300 to get your cat out. And again, cost becomes a factor. It's much easier. So, okay, let's forget about Fluffy. We'll just get another cat off Gumtree. And again, not get it desexed, etc. So getting impound is I mean, the pound is the most dangerous place for a cat to end up. The likelihood that they'll be killed is around 50-50, even with a microchip, even if this is a lovely, calm, perfect cat in your home. I've got cats that are absolutely lovely. As soon as I put them into a carrier and take them to a vet, they think they're the king of the jungle. And they turn into a snarling, hissing machine. They look like feral cats. They really do not like being imprisoned, and therefore it is very easy that the microchip might not get scanned properly. Someone's too afraid to put their hands in there and scan, or that they might get killed. It's extremely dangerous place for them. So if we can put simple processes in place where a cat remains in its local area, is able to be reunited, that the person is assisted with whatever it is that they might need to contain their cat or keep it from bothering the neighbours, or finding out however it is that that cat came to be impounded for whatever reason, and seeing if those issues can be addressed.
Sounds a little bit too much like common sense to me, Samantha.
Absolutely. I mean, and we have people that want to give us cats that they've found or that they're concerned about or whatever it is. And of course, we're not allowed to accept them under the current legislation. But I've had people turn up with a cat in a duffel bag on a Sunday. And, this cat keeps coming to my house. You take it. And unfortunately, I'm not able to scan it, get the information and reunite it with its home. But I've got a cat sitting in a duffel bag. That someone clearly doesn't want in their yard. And in that situation, we actually went and door knocked and found the owner of the cat and were able to return the cat to it. But all sorts of things happen, so a simple reuniting would be great.
Fantastic. And look, so I've got one final question. If you could leave our listeners today with one thought, what would it be?
Authorities have been trying to kill their way out of this issue for 100 years, and it simply does not work. We need changes, and the changes that you're bringing about in the legislature are a fantastic start. But we need to look at jurisdictions similar to our own overseas and see how it is that they've managed to stop the killing, because the definition of insanity is to keep doing the same thing and expecting a different outcome. Well, we've been trying to kill cats since, they arrived here in Australia, and it simply does not work. The cat population continues to increase over time, and we need to look at different ways of doing it.
And look, I couldn't agree more, and particularly on the point of view that we don't even have to reinvent the wheel here. There are jurisdictions overseas that have done incredible work that we could just adapt to what we need to have in here. And when I talk of adaptation, I don't mean environmental adaptation. I mean just wholly and solely legislative adaptation, so that what we're going to be doing doesn't break any of the laws and we don't have to change any laws to make it fit. I think it should be the most simple thing for us to do. And I'm looking forward to trying to be part of that and trying to actually get that across the line. And the input of people like yourselves will be absolutely essential in how we try and get that all to happen and to work cohesively. Look, thanks, Samantha, so much for your time today. I've really enjoyed it. It's been in the lead up to the legislation, the motion that we brought to the Parliament last week. I got to meet a whole host of people like yourself, and the stories have just been absolutely incredible, at times heartbreaking, but that common theme has been there all along. You're all saying the same thing. You're all singing from the same hymn book. So I think the message to government is very, very clear. And so, again, thank you so much for the work that you do and for all of the work that you do for animals.
Thank you. Absolutely.